health. And I wasn't just another worried husband. I was a medical doctor. As a physician for more than 30 years, I was accustomed to having guns words to medical questions. After graduating from the University of Colorado Medical School and doing postgraduate at Mercy Hospital in San Diego, I settled into a successful family practice in a small city in western South Dakota. Along the way, I met and married Liz. She had some health problems, but Liz honestly thought that if she married a physician, her health would improve. Was she ever wrong? Before long, our family included 3 children under the age of 4, and a busy Liz grew increasingly weary. Every mom with little children is tired, but Liz seemed unusually fatigued. Although she was only 30 years old, she told me she felt 60. As the years passed, she developed more symptoms and health problems that required several medications. By our 10th anniversary, Liz was so tired that most of the time she labored to put one foot ahead of the other. She experienced sensual, total body pain, overwhelming fatigue, horrible allergies, and recurrent sinus and lung infections. Finally, after testing and evaluation, Liz's doctors diagnosed her problem as fibromyalgia. This medical condition involved as an array of symptoms, the worst being chronic pain and fatigue. In years past, fibromyalgia was called psychosomatic rheumatism, and doctors believed the disease was all in the patient's head. We have since learned that fibromyalgia is a true, miserable disease, which I can vouch for after watching my wife suffer. Liz was willing to try anything so that she could continue the pursuit of her passion, training, and riding dressage horses. But in time, her pain and fatigue curtailed all work with her beloved animals. She became so severely tired that she wasn't able to stay up much beyond 8 p.m., and she struggled just to keep up with basic domestic chores. Since fibromyalgia has no cure, all I could do to ease Liz's symptoms was load her up with medications. I had her taking amitriptyline at night for sleep, anti-inflammatories for pain, muscle relaxants, inhalers for her asthma and hay fever, Seldane for allergies, and eventually weekly allergy shots. In spite of my efforts and all this medicine, year after year, her health gradually worsened. In January of 1995, Liz and I concluded that more exercise would benefit us both. We had put on extra pounds and made a New Year's resolution to get back into shape. Liz tried hard, but missed more workouts than she made. One infection after another left her sick and on antibiotics more often than not. In March, she developed severe pneumonia. She labored to breathe as one lobe of her lungs became completely filled with infection and closed off. The physician caring for her lung was very concerned it might not heal and could possibly even require surgery and removal. We consulted an infectious disease specialist, and he placed Liz on intravenous antibiotic, steroids, and nebulizer treatments. Fortunately, within 2 weeks the pneumonia cleared. Her cough, however, persisted, and she continued on heavy medication for months. Of greater concern was her fatigue, which was now worse than ever. Liz was out of bed only about 2 hours a day. Her asthma and allergies were raging, and only with luck could she make the walk to the barn to see her horses. Liz was so sick. The children took turns staying home from school to care for her. Constantly in bed, she felt too weak even to watch TV, or yet. This went on month after month. Although I maintained my professional exterior, on the inside, I was growing desperate. I visited several times with the pulmonologist and the infectious disease specialist. They assured me that with Liz's diagnosis, they were doing everything possible. When I asked how long it would take for her to recover, the answer was 6 to 9 months, or maybe never. About this time, a friend of the family shared with Liz that her husband had also had pneumonia and had experienced significant fatigue during the recovery. He took some nutritional supplements and they had helped him regain his strength. Liz and her friend were aware of my negative attitude toward vitamin supplements, so Liz knew she would need me blessing before trying them. When she asked, even I was surprised at my response. Honey, you can try anything you want. We doctors certainly are not doing you any good.